So, good day everyone. I'm Joana Ivy M. Ramos from BSN2 Black D, a student nurse from the College of Nursing at Nueva Ecija University of Science and Technology. So, for today's video, I am going to perform and demonstrate Folley catheter insertion. Folley catheter should be used only when indicated, as use increases the risk of catheter-associated urinary tract infection and other adverse effects. Indwelling urinary catheters are most commonly used to assist people who cannot urinate in their own. Indications for using a catheter include providing relief when there is urinary retention. Next is for monitoring urine output for critically ill persons and managing urination during surgery, and providing end-of-life care. So, the goals of Folley catheter insertion are the following. First is to relieve discomfort due to bladder distension or to provide gradual decompression of a distended bladder. Next is to assess the amount of the residual urine if the bladder empties incompletely. Next, to obtain a sterile urine specimen, to empty the bladder completely prior to surgery, and lastly, to facilitate accurate measurement of the urinary output for critically ill clients whose output needs to be monitored hourly. For the assessment, first, determine the most appropriate method of catheterization based on the purpose and any criteria specified in the order, such as total amount of urine to be removed or size of catheter to be used. Next, use a straight catheter if only a one-time urine specimen is needed, if amount of residual urine is being measured, or if temporary decompression or emptying of the bladder is required. Next, use an indwelling or retention catheter if the bladder must remain empty. Intermittent catheterization is contraindicated or continuous urine measurement or collection is needed. Assess the client's overall condition, determine if the client is able to participate and hold still during the procedure, and if the client can be positioned supine with head relatively flat. For female clients, determine if she can have knees bent and hips externally rotated. Determine when the client last voided or was last catheterized. If catheterization is being performed because of the client has been unable to void, when possible, complete a bladder scan to assess the amount of urine present in the bladder. For the planning, allow adequate time to perform the catheterization. Although the entire procedure can require as little as 15 minutes, several sources of difficulty could result in a much longer period of time. If possible, it should not be performed just prior to or after a meal. Next, some clients may feel uncomfortable being catheterized by nurses of the opposite gender. If this is the case, obtain the client's permission. Also consider whether the agency policy requires or encourages having a person of client's same gender present for the procedure. For the equipment needed, sterile catheter of appropriate size, an extra catheter should also be at hand. Next, catheterization kit are individual sterile items. For example, the sterile gloves, waterproof drapes, an antiseptic solution, cleansing bowls, and forceps. We should be also needing water-soluble lubricant, urine receptacle, and specimen container. So for an indwelling catheter, we should be needing the syringe prefilled with sterile water in amount specified by the catheter manufacturer. Next one is the collection bag and tubing. 5 to 10 ml and 2% of silocaine or water-soluble lubricant for male urethral injection if agency permits. Next, clean gloves. Supplies for performing perineal cleansing. And bath or blanket or sheet for draping the client. We should also be needing adequate lighting, or we should obtain a flashlight or lamp if necessary. For the implementation, prior to performing the procedure, introduce yourself and verify the client's identity using the agency protocol. Explain to the client what you are going to do, why is it necessary, and how he or she can participate. Next, perform hand hygiene and observe appropriate infection control procedures. Next, we should provide for the client's privacy. Place the client in the appropriate position and drape all the areas except the perineum. For female, supine with knee flex, feet about 2 feet apart and hips slightly externally rotated if possible. For the male clients, supine and thighs slightly abducted or apart. Next, establish adequate lighting. Stand on the client right if you are right-handed and the client's left if you are left-handed. Next, if you are using a collecting bag and it is not contained with catheterization kit, open the drainage package and place it at the end of the tubing within reach. If agency policy permits, apply clean gloves and then inject 10 to 15 ml silocaine gel into the urethra of the male client. Wipe the underside of penile shaft to distribute the gel up in the urethra. Wait for at least 5 minutes for the gel to take effect before inserting the catheter. Remove and discard the gloves and perform hand hygiene. Next, open the catheterization kit. Place a waterproof drape under the buttocks of female or penis of male. Without contaminating the center of the drape with your hands, apply sterile gloves and organize the remaining supplies. Saturate the cleansing balls with antiseptic solution. And then next, open the lubricant package and remove the specimen container and place it nearby with the lid loosely on top. And then attach the refilled syringe to the indwelling catheter inflation hub. Apply agency policy regarding pre-testing of the balloon. Next, lubricate the catheter 2.5 to 5 cm or 1 to 2 inches for females and 15 to 17.5 cm or 6 to 7 inches for males, and place it with the drainage end inside the collection container. If desired, place the fenestrated drape over the perineum, exposing the urinary meatus. Next, cleanse the meatus. Note the non-dominant hand is considered contaminated once it touches the client's skin. For women, use your non-dominant hand to spread the labia so that the meatus is visible. Establish firm but gentle pressure on the labia. The antiseptic may make the tissue slippery, but the labia must not be allowed to return over the cleaned meatus. Note: location of the urethral meatus is best identified during the cleansing process. Pick up a cleansing ball with the forceps in your non-dominant hand and wipe on one side of the labia majora in an antero-posterior direction. Use great care that wiping the client does not contaminate the sterile hand. Use a new ball for the opposite side, repeat for the labia minora, and then use the last ball to cleanse directly over the meatus. For men, use non-dominant hand to grasp the penis below the glans. If necessary, retract the foreskin, hold the penis firmly upright with slight tension. For the next procedure, insert the catheter. Grasp the catheter firmly 5 to 7.5 cm or 2 to 3 inches from the tip. Ask the client to take a slow deep breath and insert the catheter as the client exhales. Slight resistance is expected as the catheter passes through the sphincter. If necessary, twist the catheter or hold the pressure on the catheter until the sphincter relaxes. Next, advance the catheter 5 cm or 2 inches farther from the urine begins to flow through it. For male clients, some experts recommended advancing the catheter to the wide bifurcation of the catheter. Check your agency's policy. If the catheter accidentally contacts the labia or slips into the vagina, it is considered contaminated and new sterile catheter must be used. The contaminated catheter may be left in the vagina until new catheter is inserted, to help avoid mistaking the vaginal opening for urethral meatus. Next, hold the catheter with the non-dominant hand. For an indwelling catheter, inflate retention balloon with the designated volume. Next, without releasing the catheter, and for females without releasing the labia, hold the inflation valve between 2 fingers of your non-dominant hand while you attach the syringe, if left attached earlier, and inflate with your dominant hand. If the client complains of discomfort, immediately withdraw instilled fluid, advance the catheter farther, and attempt to inflate the balloon again. Next, pull gently on the catheter until resistance is felt to ensure that the balloon has inflated and to place in the trigone of the bladder. Next one, collect the urine specimen if needed for a straight catheter. Allow 20 to 30 ml to flow in the bottle without touching the catheter to the bottle. For an indwelling catheter, pre-attach to a drainage bag. A specimen may be taken from the bag. This is initial time only. Next, allow the straight catheter to continue draining into urine receptacle if necessary. Open system. Attach the drainage of an indwelling catheter to collecting tubing and bag. For the next procedure, examine and measure the urine. In some cases, only 750 to 1000 ml of urine are to be drained from the bladder at one time. Check agency policy for further instruction of this should occur. Next, remove the straight catheter when urine flow stop. For an indwelling catheter, secure the catheter tubing to the thigh for female clients or upper thighs or lower abdomen for male clients with enough slack to allow useful movement. And then next, wipe any remaining antiseptic or lubricant from the perineal area. Replace the foreskin if retracted earlier. Return the client to a comfortable position and instruct the client on positioning and moving with the catheter in place. Next, discard all supplies in appropriate receptacles and discard the gloves. Perform hand hygiene. Document the catheterization procedure including the catheter size and results in the client record using forms of checklist supplemented by the narrative notes when appropriate. Good day, ma'am. I am Joana Ivy M. Ramos from DSN2 Block B. Your student nurse for this time, and for today I will be performing the Folley catheter insertion. So, may I know your name, ma'am?
Silaita Manolo.
And your birth date po?
December 16, 2001.
Yes, ma'am. Okay, thank you. And documentation. First, notify the primary care provider for the catheterization results. Next one, perform detailed follow-up based on findings that deviated from expected or normal for the client. Relate the findings to the previous assessment data if available. Teach the client how to care for the indwelling catheter, to drink more fluids, and provide other appropriate instructions.